Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. So this month we are focusing on hair loss and the treatment options that you offer patients here in the office.
Great.
Can you first explain to me what causes hair loss?
Sure. Well, generally in men, as we get older, a type of testosterone changes in the scalp, and that change in this testosterone affects the hair follicles. In some men, it causes those hair follicles to die off. Once that happens, unfortunately, there's really no way to get those hair follicles back. There's no magic, cream or pill. There are some things we can do medically, non-surgically to prevent hair loss, but once those hair follicles are gone, really the only option would be to consider hair transplantation.
Okay. And is it different in women then when they experience hair loss, the reasoning for that?
In women, it's a little different generally, and there's several conditions that might cause hair loss, but hair loss is actually common in women. And unfortunately, it's accepted in men. It's normal to see a man with a receding hairline or thinning hair, but not so much in a woman. And socially, that can be quite a problem. But there are some things that we can do to help hair loss in women as well.
So the hair transplant procedure that you offer is called NeoGraft. Can you explain to me what NeoGraft is?
Sure. So NeoGraft is actually a brand name of a machine that allows us to transplant hair. So in our practice, we do a technique called follicle unit extraction. It's commonly called FUE. So FUE is really the gold standard of hair transplantation right now. And NeoGraft is basically a machine that allows us to obtain these hairs and then transplant them as well. There are some robots out there that transplant hair, believe it or not, but they actually use the same technique. It's just instead of a human doing it, it's an actual robot using this FUE technique.
Okay. So before NeoGraft, that machine being available, what other forms of hair transplant were there?
In the past, hair transplantation involved moving hair from the back of the head to the balding areas up front or up top. But generally, it involved somehow surgically extracting those hairs. So making incisions, making punches, and obtaining hair. But unfortunately, that caused scarring. So in the last 5 to 10 years, hair transplantation has moved away from those techniques and moved towards the FUE process.
So is the recovery or healing time a lot different with NeoGraft versus the previous forms of hair transplantation?
Yes. So the beauty of NeoGraft is there's no incisions made. The NeoGraft machine simply plucks out and vacuums up the hair follicle, and it's non-surgical. So there's no healing. There's no incisions to heal. There's no surgery involved. So the recovery is a lot easier.
Okay, so you say there's no scarring at all then when it comes to the NeoGraft procedure?
It's almost impossible to notice where we borrowed the hair from.
Okay.
I tell patients their barber won't notice anything. So that's the nice thing is the donor area, which is generally the back of the head, it's nearly impossible to notice that we borrowed hair from there.
That's awesome. So who in particular would be a good candidate for this procedure? Would you say like someone who's continuously seeing hair loss? Are they a good candidate to have this procedure?
Well, really anybody who has some hair loss is a potential candidate. The more hair loss you have, then obviously we need to move more hair to fill in those areas so that sometimes it might involve several treatments. It's not uncommon for a man with a lot of balding to require 2 treatments, for instance. But really almost anybody with some thinning or a receding hairline is a candidate. I think the most common patient that we have is a guy who has a receding hairline in his temples particularly and just wants that filled in to help restore that hairline.
And what would you say the cost of the procedure runs about?
So in this type of medicine, in our practice and pretty much nationwide, you're paying for the amount of hair that we move. So literally, when we move the hair, it's counted, we keep track of it, and then there's a charge based upon, believe it or not, the number of thousands of hairs that we move. And in the treatment, sometimes we'll move several thousand hairs. It's not uncommon. So to answer your question, these are long procedures. It's a bit tedious. We're literally obtaining hairs one at a time and then placing them one at a time. So the procedures themselves are, it's not uncommon for it to be a 6 or 7 hour procedure to do this sort of thing. So the cost, you're looking at something in the $5,000 to $12,000 range, depending upon how much hair we're moving.
Okay. And this isn't something that would ever be covered by insurance, correct?
No, it's these are all considered cosmetic self-pay procedures, so It's not something insurance companies get involved with.
Okay. And so for someone who does have a NeoGraft procedure, are there any activities or products or anything that they should avoid following the procedure?
Well, so after the procedure, there's about a week where the hairs that we transplant are a bit fragile, so you have to be real careful with your activity and real careful washing your hair. But beyond that week, things are healed, and long term, it's your hair. You can style it, comb it, color it, do whatever you want to do to it. The hair itself grows normally long term, so long term, there's really no restrictions whatsoever.
Okay, great. Yeah. Thank you.
Sure. Thank you.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.